All right, let's move on to the next slide. Can cultural bound syndromes be found in non-Western countries? The answer to that question is yes. Cultural bound syndromes can be found all over the world. All the examples that what I was using earlier are usually caused by some form of distress, whether through the loss of a loved one or some sort of extreme stress situation. This is probably why the DSM-5 recategorized some of the culture-bound syndromes as cultural concepts of distress. Many culture-bound syndromes, although seen in a specific region, are not necessarily confined to specific cultures. It can be seen in different parts of the world under many different names. The reason many culture-bound syndromes are considered exotic is because of the bias of some past Euro-American psychiatrists. This led to the idea that somehow cultural-bound syndromes were only confined to non-Western cultures, and this is untrue. Even though I used some examples, the examples I used were mostly from non-Western cultures. Now let's move on to some examples of Western cultural bound syndromes. My first example uh, is anorexia, which I'm sure you've heard about, but it's defined as an emotional disorder characterized by an obsessive desire to lose weight by refusing to eat. It's seen in both the United States and around the world. The treatment for this syndrome is the same as most cultural bound syndromes: therapy. Again, cognitive behavioral therapy, which helps people modify their negative thoughts associated with stressful functions, is very helpful in this situation. The next example is falling out. Falling out is a culture-bound syndrome usually seen in the southern United States and the Caribbean. Falling out is characterized by a sudden collapse preceded by dizziness and a spinning sensation. It is described by a psychiatrist as a constricted, quote, constricted consciousness as a psychological response to anxiety and specific stressors, unquote. It's usually left untreated unless it becomes disabling, as it is often seen as a normal response to stressful situations. In both cases of anorexia and falling out, there were no indigenous treatments to the two syndromes. But in both cases, therapy was the quote unquote cure to the culture bound syndrome. Now, moving on to some additional information about culture bound syndromes. According to the American Psychiatric Association, many of these patterns, quote, many of these patterns are indigenously considered to be illnesses or at least afflictions, and most have local names. Although presentations conforming to the major DSM-4 categories can be found throughout the world, the particular symptoms, course, and social response are very often influenced by local cultural factors. The term cultural bound syndrome is also controversial, in that there is a difference in opinions between anthropologists and psychologists, or psychiatrists. Anthropologists have the tendency to emphasize the culture-specific dimensions of the syndromes. This is while physicians tend to emphasize the neuropsychological dimensions of the syndrome. Moving on to my conclusion. To reiterate, even though there is no biological data, there is plenty of archaeological and historical data that can be collected from the indigenous people. Some studies on culture-bound syndromes suggest that culture-bound syndromes represent an acceptable way among vulnerable individuals to express distress in the wake of a traumatic experience. Since there is no objective biochemical or structural alterations of bodies or body organs or functions of those organs, It's often hard to observe cultural bound syndromes when they happen, which is why it is important that anthropologists in the field ask as many questions as they can about culture bound syndromes to determine its symptoms and causes. It is very important that healthcare professionals, when trying to diagnose and treat culture bound syndromes, that they have some form of cultural awareness. One should always remember perspective, and by looking at other cultures, we can often expand our own perspective. There is always more to learn and understand when it comes to mental health awareness. Thank you for your time.